Good afternoon, everybody, and thank you for joining the last or number 6 action period call for the Injury Prevention Plus Safe Environment for Every Kid or SEEK-QI program. We made it to the end. I can't believe that we're here, and I want to express my appreciation for all of you for showing up today and showing up for the last few months. We want to thank our program partner, as always, the Ohio Department of Health Violence and Injury Prevention Section. And again, welcome all of you. We will start with Zainab and data review like we have in the past. And then we will hear from Stephen M. Dunn of ODH on Project Dawn and community harm reduction. And then QA Corner and next steps with me. So welcome and thank you again for your really hard work during the last 6 months. I know there's been a lot going on with everything kind of in the world and some of you personally and within your practices. So again, thank you so much on behalf of your patients and caregivers and families for working as hard as you have. And on behalf of the Ohio AAP, we really appreciate your hard work as well, of course. So if you could do so safely in the chat, please share your name and practice name for collecting who was here today. Okay, Zainab, I have your slides.
Thanks, Brooke. And yes, like Brooke said, I wanted to thank everyone for submitting their data and giving us their patient totals. We understand, like Brooke said, that there's been a lot going on around the world and probably in your practices too. So again, thank you everybody that's, stuck with us, to the end. This is going to be, the last presentation of data. Again, you'll get your individual level data. Probably by the end of the week or maybe next week. But again, if anyone has any questions or if anything doesn't seem right, please let us know. So again, I mean, we've seen these slides every month, and then we have 5 umbrella topics for the SEEK program. The social needs, we had a little bit again with the screening, we've seen perfect screenings throughout. And again, screening here means that they completed the entire survey. In terms of counseling, if they indicated that there's a need for any of the social needs questions, then whether or not that counseling was provided by you or any of the other physicians in the practice. We did see a little bit of a dip for the birth to 12 months. Some practices had low numbers of needs, and when you have low number of needs, it has a bigger effect on the total. But we did see really good values and really good scores for the older age group, and we've seen that consistently throughout the entire program. For the younger age group, we've seen a little bit of low numbers. It increased a little bit in April and it dipped a little bit back down. But hoping for the sustainability, we can get that number back up. Next slide, please. For family needs, I mean, we've seen, again, very good scores here in terms of both screening and counseling for both age groups. We had 100% counseling and family needs for the older age group. So everyone can give themselves a pat on the back for that. Again, we saw here better counseling for the family needs than we did for the social needs in the previous slide. Next slide, please. The home safety, which is our biggest portion of the survey. Again, we're seeing 100% in terms of screening. These numbers have been pleasantly, I've been pleasantly surprised because it's the largest portion of the survey, we find the most number of needs there, or the more families with more needs, especially for home safety. But we've seen really great values and really great scores, an upward trend. We're both over 90 for both age groups for home safety. For car seat safety, for car seat safety, we saw an increase for the birth to 12 months, but we did see a little bit of a downward trend for the older age group. I've seen overall that there's not a lot of need for the car seat safety. So not a lot of families are saying they have an issue or saying they need help with the installation of their car seat. So again, because we have a low number of needs, when those are counseled on, if we're only counseling a few of them, we're seeing a bigger effect again because the number of needs overall is generally smaller for car seat safety than for the other topics, and safe sleep as well. Next slide, please. But safe sleep, because it's only asked to the lower age groups, to the birth to 12 months. We're seeing a little bit of a downward trend from March through May. We're hoping to get that a little bit back up. March was our best month, but if we can get that back up during sustainability to the 80s, that would be great. Resources provided, again, we're seeing an upward trend since the beginning of QI. So if you can see in January, we started about the high 50s and now we're at the low 90s, high 80s for both age groups. So we've consistently seen that trend go upward. So, I just wanted to, again, thank everybody for all the effort that they've put in, especially with the resources. I know that you guys had resources in your practices that were specific that you've had even before QI. As you can see here through our baseline, you had consistently between 70 and 80%. But we saw that number increase towards the end of QI, especially with our resource sheet. I've seen that the majority of you guys are giving them the resource sheet that we provided, the AAP. So that resource sheet has all kinds of information that they need for all the different topics. So again, thank you for providing that to your patients. The data tool completion rate, unfortunately, we've seen this number consistently decline. I, I'm not 100% sure. I know one of our practices has a very large number of patients, and it could be a reason that that could be a reason why they can't get to all of them. Some practices have done great, but again, we've seen this number consistently decline. We're at about 15%. So 15% of the total patients that are coming into your practice for that month are receiving the screening tool. I can hand it back over to Brooke. I know she wanted to touch a little bit on this, so.
Thanks, Zainab. Yeah. So you just saw kind of the rate and the direction that it was moving. And you also know, maybe from mentions at the beginning, that Ohio AAP is always running program PDSA cycles kind of on ourselves. And certainly your experience helps us to improve. You saw in the sustainability and exit survey that we ask you a lot of questions on how you are feeling about the program and the skills that you hopefully developed, and the compare contrast between before the program started and now. So that means a lot for you to share your experience to certainly help us improve in the programs. So having just seen the data completion rate and kind of the numbers there, and I know I've spoken to some of you about kind of what's going on within your practices, and we fully appreciate that life happens. But for those of you who we maybe haven't touched base with, or if we've talked before and you haven't shared something and it's a new find for you to have shared kind of a barrier for the completion rate. If you don't mind starting to think about what barriers were present for you in your practices and maybe your staff, maybe some turnover, maybe some things happening that may have contributed to the data tool completion rate going in the direction that it is. You can certainly email me, or we can discuss it later in this call. You can send me a personal message on here. We won't be sharing this out and attaching your name to it. It's going to be kept in, again, applying it to our PDSA cycle for internal use. But we are curious to know what was happening within your practice, that you had good intentions of completing as many screening tools as possible, but the barriers didn't make it possible for you to do that kind of within this wave. So again, you can tell us in any manner that you feel comfortable with, but we will revisit this at the end of the call. Zainab, thank you.
Yeah, thanks, Brooke. So like Brooke said, if there's any barriers, please let us know. If it's something that we can, address in future waves, or it's something that we can keep in mind or include in our write-up at the end. Like Brooke said, we're constantly doing PDSA cycles on ourselves and on our programs. So any feedback that you can give is appreciated and valued. So please, we really ask that you, take the time to think about that, so we can have a discussion towards the end. In terms of the caregiver feedback survey, for the patients that are completing the survey, we have 98% also completing the family feedback survey. I know that we I know that we have some practices submit paper copies. Those are not included in here, just because they didn't get the chance. And Brooke, this is also information that we should both keep in mind. So because they didn't have the option to complete the survey, they're not included in the denominator here. So I just wanted to be fair to our program and to the rest of the practices that had their patients complete the family feedback survey. Anyone that submitted paper surveys their patients didn't have the option to complete the survey, so they're not included in here at all, even in the denominator when we're calculating these percentages. Next slide, please. Within the caregiver feedback survey, we ask how they plan to change, or if they plan to change or make a change in any of the topic areas that they have. So for each need that they indicate, for each counseling opportunity you have with them, they are asked whether or not they plan to make a change. And so 89 or 90, almost 90% of the time of those questions, they plan to make a change in at least in them. And then 10% of their needs, they don't plan to make a change in that. So again, this is based on a specific need, not based on the family. Next slide, please. And then for each of those needs, we ask a scale on how likely they are to make that change. Again, and this is question specific or need specific. So for 44% of those needs, they're ready to make a change. For 32%, they're seriously considering to make a change, seriously considering making a change. And for 18%, they're thinking about changing. So we can see here over 90% of their needs, they have some sort of willingness to make that change. So this is, a great opportunity, again, for you to provide that resource sheet for them so that they can have those resources available to them, or they can take into consideration the counseling that you provided to them. So this is just for you to understand, the real life value that you're providing from understanding the needs that they have and providing that counseling to them. Next slide, please. And then this is the last portion that we added specifically to this wave, which is looking at focused populations. And again, our focused populations are our Medicaid patients, African-American patients, our other race. So that includes Asians, Pacific Islanders, and then we have the Hispanic ethnicity. So all of those are considered our focused populations. These groups are not mutually exclusive, so they could be African American and Hispanic, or they could be African American and a Medicaid holder. So we can see that over 50% of your patient population, or at least the patient population that completed the survey, has Medicaid. And again, Medicaid is a measure of socioeconomic status here. And then we have close to 30% are African American in race. And then we have the lowest population, which is Hispanic. The lowest portion of your population is Hispanic. And we've seen that consistently throughout all of the months. So it looks like this is just the base population and what it looks like at your practice. But again, here is the number or the percentage of the data tool completion rates that were completed by those patients. And again, we have the majority completed. Again, by half of those that completed the survey are Medicaid patients. Next slide, please. This slide is looking specifically at their needs and whether or not they received counseling. So again, this information is more so for the practices themselves, so they can understand where their areas of opportunity are specifically for which populations. So for example, we're seeing in terms of all of their needs, especially in the last month, we saw a really great counseling. And we saw that again with the first few slides that we saw in terms of screening and counseling. We did see a little bit of a decrease overall when we're comparing all of the focused populations in terms of the Medicaid. So they had more needs. They had more needs that weren't counseled than, for example, the other races and the Hispanic focused groups. If we're dividing their needs and their counseling rates by topics, so like by injury or social determinants of health, we're seeing that the social determinants of health, those needs are counseled on in all of the focused populations, a little bit less than for the injury. And so that's just something to keep in mind. And that's understandable. With injury, it's a lot more preventable. even with, with the resources that we provide, social determinants of health, not so much. So it makes sense for us to see, these differences in counseling rates. But again, this just gives you an overview of which specific populations you have opportunity with to increase those counseling rates and to increase those screening rates. Um, yeah, that's the end of the slides that I had prepared. If anyone has questions, please put them in the chat, or you can take yourself off mute. If any questions do come up later on, we can definitely answer those through email or hop on a call or anything like that.
So just quickly, next steps, if you could all submit any outstanding program information as soon as possible. So stipend information, questions that you have, the exit survey from SurveyMonkey, and then returning of the iPads. I am happy to send you any email with any information if you don't see it in your inbox. And for sustainability, we will continue to talk about this. Even after program wrap, you will hear from us about what sustainability looks like, and we will ask you for what pieces and parts of SEEK you have been able to sustain and continue to share with your patients and families. But we will also keep up the SEEK resource page. So all those good resources from this wave and in the county level resources and state and national. We will keep those resources up for you to continue to use and to share and refer. And if you don't see something on there, let me know kind of going forward. I am still available and you can email us anytime. And if you want to join us this year for our sports themed annual meeting, it's in October, and we're having a Ohio Pediatric All-Stars playing offense on the home field of the future pediatricians and pediatrics. So we will hear about AI, which is kind of a hot topic now, behavioral health, immunizations, infant feeding, obesity treatment, including GLP-1s, and sports medicine. So we will be happy to see you in October 10th and 11th. If you have any questions, you can scan the QR code or let me know. Okay, any ending thoughts for us? Again, we will keep up the communication with you as needed, and you will certainly be hearing from me with additional emails, including data. But again, I want to thank all of you for joining today and for your hard work throughout the wave. Sorry about the Project Dawn presentation, but I will get that to you as soon as it is available. So thank you all so much. Thanks again for your hard work, and we will talk soon.